Hi, welcome back to Your Checkup. We are the patient education podcast where we bring conversations from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Ed Dulesky, a family medicine resident in the Philadelphia area.
And I'm Nicole Rufo. I'm a nurse.
And we are so excited that you were able to join us here again today. It's like a buzzer beater. I mean, it's Sunday night. We are getting this together. And we'll do a little brief warm-up here before we dive into our topic here, but huge congratulations to Lauren and Brett, who are my sister and my brother-in-law, who just got married yesterday. It was a beautiful day. The ceremony was amazing. Right on the beach. The weather was perfect, a little breezy, and it was just really great to get the chance to see how much you guys love each other and celebrate. And celebrate we did.
Mm-hmm. We did.
Yeah. So Whole Foods makes a mean chocolate chip cookie. They are delicious. Is it like a brown sugar cookie?
A brown butter. It's the brown butter chocolate chunk cookie dough. In like the little freezer section with what else is in there? I don't know. We only ever get the cookie dough.
Yeah, I have like a one-track mind when it comes to it. I really we go straight for the cookie dough. I picked it up this time. But the ins and outs of how to actually produce the cookie are beyond me. And you stick it in the oven and all that. But, well, there's a certain amount of waiting afterwards for it to get because we like them softer, right? Mm-hmm. So, you're a finesse cooker. Like, you zhuzh, you give spice and love, and, base the timing off of vibes. But I'm, strict. I'm like baker. I need to know exactly how many minutes the HBE's hard-boiled eggs, for those who don't celebrate, are going exactly in. So 7 minutes, by the way, is the answer. Okay.
Yeah. For the perfect middle.
Yeah.
Eddie just found out that hard-boiled eggs can be good.
Yeah, we actually had them every single day last week.
And I think the week before that, too.
And maybe the week before that. It's a really easy, convenient way, and quick in the morning. I mean, can we be making more than 2 at a time? 4 at a time? We had a brief poached egg run there. That's a little tricky, but I'm happy to do it. It's really awesome. All right, what do you say? Should we do it?
Yeah.
What are we going to talk about today, Nick?
We're talking about GERD. GERD.
So GERD stands for gastroesophageal reflux disease. So this actually is a digestive disorder when acidic contents from the stomach go back up into the esophagus. It basically happens to anyone, usually after a large meal, especially the one we're having here with the red sauce. We're having our pasta and gravy. And it happens frequently and can cause bothersome symptoms and honestly even some damage there. If it's really at the point where it's more bothersome to you and it's causing all those problems, that's usually when it's called GERD. So GERD actually comes up because that acid gets flicked up to a spot in the esophagus where there are nerves. Because, for a certain portion of your esophagus, there are no nerves. And then when it goes up high enough, it can actually lead to that symptom of heartburn, which actually is the most common symptom. This really looks like a burning sensation in the chest. I mean, I had this growing up. We would go to the pediatrician, formal consultation to the pediatrician of I'm saying I have chest pain. I have heartburn. But that's what this is most commonly. I mean, did you ever have heartburn?
Yeah, here and there.
All right. So there are more symptoms than heartburn. It can look like regurgitation, or basically when you taste the food or stomach acid in your mouth or food comes back up. Sometimes even people experience chest pain. And if it's a little bit further down, they experience swallowing and even a persistent cough. So it's more than just heartburn.
So what causes that backflow of the stomach acid that you mentioned?
So there's a ring of muscle at the bottom of the esophagus called the lower esophageal sphincter. It's abbreviated LES. And normally it acts like a one-way valve. It allows food to go into the stomach from the esophagus, and it closes up when the food passes, and it prevents food and acid from coming back. But in people with GERD, this muscle can weaken or relax at the wrong times, and then it allows the stomach acid to escape upwards where it shouldn't belong.
Are some people more prone to developing GERD than others?
Yes, there are certain risk factors, is what we'll call them. There's a condition called hiatal hernia, which actually is a condition where the stomach pushes up through the diaphragm. So that's one risk factor. Obesity, of which we've had several different conversations and episodes, is also a risk factor, usually probably due from the added pressure in the abdomen. And women also experience a lot of GERD during pregnancy, unfortunately for them. So that's a very, very common symptom that comes up. But usually after delivery, this resolves. And so there are more to the risk factors than these conditions. There are actually certain foods that can relax the lower esophageal sphincter, making the acid reflux more likely. This includes things like fatty foods, chocolate, peppermint, caffeine, and alcohol. Smoking also aggravates GERD, and some medications do that as well.
Okay. So how do you know if something is just occasional heartburn or if it's something more serious?
So if you're having only mild heartburn, only occasionally, some simple lifestyle changes and over-the-counter medications can probably be enough to manage it. But if you're experiencing more frequent or severe symptoms and you're starting to have difficulty or pain with swallowing, chest pain that feels like food is stuck in your throat, or if you lose your appetite or have signs of bleeding, those are things to go see a doctor about.
And when you go to the doctor, how would they diagnose GERD?
So it's a good question. Doctors actually diagnose GERD based on symptoms and risk factors. So really just listening to the story, history, physical, and it's a pretty classic thing, but it can present in a sneakier kind of way where it's not slam dunk heartburn. I've had plenty of people who have had chronic cough who have ended up having GERD, or they get a metallic taste in their mouth. And that leads to prompting to think about GERD. But, they may trial a medication to see how the symptoms improve or if they change. And if they don't get better, this might prompt further testing with something called an upper endoscopy. This is when a thin, flexible tube with a camera is used to examine your esophagus and your stomach, and this is usually done by your friendly neighborhood gastroenterologist. Mm-hmm. There are other ones, like a pH study to measure how much acid is in your esophagus or your stomach, and there are others other studies to measure the pressures in your esophagus, something called the manometry. But those are a little more rare. I think a lot of people usually just go ahead with the history and the physical.
So what happens if our GERD is untreated?
So, at best, it just remains bothersome. At worst, it can lead to some chronic changes. And so there are some serious complications associated. Over time, the stomach acid can damage the lining of the esophagus, leading to something called esophagitis. And this is something we've talked about earlier in other episodes, where if you add itis at the end of something, that means inflammation of. So this can cause bleeding and ulcers, but the acid itself doesn't belong in the esophagus. And so the tissue isn't used to handling that. The stomach is built to deal with this acid, but the esophagus isn't. So if this happens day after day, over and over again, there can be some scar tissue formation and narrowing of the esophagus. And also, if there's high enough exposure over a long enough period of time, there can be a precancerous condition called Barrett's esophagus. And that's a precursor to esophageal cancer, which thankfully these are all rare, but it's worthwhile that if you have chronic treatments, that's a chronic GERD rather, that's why they do the endoscopy as well.
So what are the treatments for GERD?
Oh, well, the treatment for GERD, usually tailored to the individual, depending on the severity and frequency of symptoms. But people came here to hear about what they can do at home. So lifestyle changes are really the most important. First and foremost, we think about the foods that we mentioned earlier. You could think about changing how much you're having those. I'm thinking about those caffeine people out there, loving the coffee, us included. Alcohol is a good opportunity to limit. But it also includes things like losing weight. There's another key piece here where like a lot of people, I think your dad does this a lot, or he should, where if you eat, you don't lay down immediately after the meal, kind of like sit upright for about 30 minutes. If you are laying down, you can raise the head of your bed a couple inches to avoid the acid from coming back. And those are pretty much the lifestyle changes, I would say.
Are there any medicines that people can take?
Yeah, there's a lot of medicines. There's medicines that are over the counter and medicines prescribed from a doctor. And if lifestyle changes aren't enough, medications may be able to help control and promote the healing from the consistent damage that happens. So there are antacids, so like anti-acid, but they just brand them as antacid. And they usually provide quick relief by neutralizing stomach acid. So these are things that are called like H2 receptor antagonists. They block and they reduce the acid production by maybe a more complicated mechanism than we need to get into. And then we have the proton pump inhibitor, or PPI, which is the most effective type of medication for GERD as we understand it. I was reading something recently that there's a new, different type of acid blocker. Not sure how much it'll be covered by insurance, as any new medication that comes out can be expensive. But just to give a couple names to have like a balanced conversation that you can keep an eye out if you're in the drugstore. The H2 receptor blocker I think of is Pepcid or famotidine. And the GERD, a couple brand names like Prilosec, or other names you'll see are omeprazole, pantoprazole, esomeprazole. These are the medicines that are PPIs. I will say one note about medicines is that they're used for a finite short period of time. These are very, very common medications, especially since you can get them over the counter. But we understand that there are some long-term risks with the medications if left unchecked and used for decades and decades. So keep an eye on that. They also may affect the absorption of other medications that are designed to be dissolved by the acid. So usually these medicines are very helpful. You take them an hour before your meal and you try to get some more comfort there. I mean, people are usually starting out with like a 2-month treatment, see how it goes, and then go from there. So thanks for sticking with me here and doing this episode late in the night here. And it's not the most ideal time to do it, but I really appreciate it. And secondly, to Nikki, I appreciate our loyal listeners who are coming back, new and old. Mm-hmm. I hope you learned something today.
Well, we met a loyal listener.
We did.
In the flesh.
We met a loyal listener in the flesh. We didn't know her before, and she came up. She popped up and she was like, "Oh my gosh, I listened to your guys' podcast." And that's a really cool thing. You get to meet people out of the blue. So really grateful that people tune in and listen. Hopefully you're able to learn something for yourself, a loved one, or
a neighbor with GERD.
And please check out our website. There are search features on the website. Now that we have a couple episodes here, doing this for a little over 6 months, if you wanted to search a topic, you'll be able to find information there. Send us an email. Look on our Instagram. See what stuff we're putting out there. Stay connected and you can send us some fan mail. But most importantly, stay healthy, my friends. Thanks for coming by. I'm Ed Dulesky.
I'm Nicole Rufo.
Thank you and goodbye.
Bye.
This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. We explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for a complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.